Hello everybody, good day. Do you know that visiting a dental clinic is one of the best experiences ever? An experience that you will not forget in a hurry. In today's video, I'm going to be telling you the expectations, what you should expect on your first dental visit to any dental clinic. So please hold on and watch this video with me to the end. My name is Jethro Joel and I'm your host for today. So if you are new to our channel, I would love you to please give us a like, share, comment, subscribe, and turn on the notification button so you get notified when next we release an interesting video like this. And then if you've already subscribed, I'm very grateful and I appreciate you for coming back to watch this video again. Now let's get to business. So I said visiting a dental clinic is one of the interesting and amazing experiences you will not forget in a hurry. Now there are a lot of people who are scared of visiting a dental clinic, especially for the first time. They'll be like, okay, what am I? I'm scared of the pains. I'm scared of I'm scared of hospitals generally, and I don't know what to expect when I get there, right? Now please do not worry. In this video, I'm going to cast out all your fears. I'm going to educate you, and I will tell you what to expect when you visit a dental clinic. And I'm very sure that by the end of this video, you will be the next in line in the dental clinic closer to you. Okay, so please hold on and watch this video with me to the end. Don't go anywhere, just hold on. So now we have different types of dental clinics, right? We have some private dental clinics, and then we have public ones. We have the ones that are owned by the government, and then we have the ones that are owned by individuals. In which, whatever may be the case, right? These two types of dental clinic all perform the same function in the sense that they help you maintain good oral hygiene, they treat oral illnesses and diseases, right? But then we have hierarchy. So there are some clinics that may not be capable enough of treating some conditions, and then they will have to refer you to higher ones, right? There is a hierarchy in health organization, all right? So if you visit a dental clinic that is maybe of lower standard and cannot perform the treatments you need, they are going to refer you to the right one that will treat you well and solve all of your problems, all right? So just make sure that you pay that visit. It is very important because they are going to treat you, they are going to observe your mouth and tell you what exactly is wrong with you and help you prevent complications. Okay, good. So now one of the first things you should expect when you visit a dental clinic, of course, just like every department of a hospital generally, is that you are going to pay for card, right? In some hospitals they call it paying for card, in some places they call it paying for clerking. Whichever may be the case, you are going to pay before you see the doctor, right? So you have to go to the payment center. When you go, at least I believe every hospital setting has a way of educating you on how to do that, right? So you are going to pay for consultation or pay for card or pay to see the doctor, whatever name they call it. You definitely have to pay in the first instance. So when you pay and then you come to the dental clinic, they are going to do you clerking. Now clerking is taking down vital information of the patient, like essential information, your name, your age, your address, where you came from, and all of that. They're also going to take your vital signs such as temperature, such as blood pressure, and other medical history and all of that. They're going to ask you some questions and document it down. So after you've paid, and then after all the clerking and vital signs taking, they are going to send you into the consulting room where you meet the senior dentist or the consulting dentist of the clinic that you visited. All right, so now the consulting dentist there will have you lie down or sit down on what we call a dental chair. This is a picture of a dental chair. So he will have you to lie down on a dental chair, and then he will use some instruments like the dental mirror and then the dental probe and possibly one or two more to examine your mouth. We have what we call the intraoral examination and extraoral examination, right? So intraoral examination is going to examine inside your mouth, the teeth, the gums, the cheeks, the tongue, and all of that. He's going to examine them and note down his observations, right? And then the extraoral is going to check the cheeks outside and the face if there is anything that is tampering with your oral hygiene. Now, at the end of that consultation, he's going to write down what he observed and he's going to tell you what exactly is wrong with you. He's going to tell you your own problems, okay? Now, after he tells you, he will also tell you the solutions. Of course, there are many options, there are many ways of treating illnesses, okay? So he will tell you the cheapest one, the most expensive one, the best one, and the most recommended one, right? And then you will now pick, you will now decide, you and him will sit down and talk and decide which one you are going for. Now, after picking the treatment you are going for, you will have to, in some hospitals, go back to the cashier or to the payment unit again and pay for the treatment that you desired. Do you understand? You are going to pay back and pay for the treatment that is going to be rendered, that's going to be offered to you. When you pay and come back, they are going to do you what we call the scaling and polishing. Scaling and polishing, in simple terms, is what we call washing of the mouth with special dental instruments, not with toothbrush and toothpaste, as we all know, right? We are going to use special dental instruments such as manual scalers, ultrasonic scalers, and etc. We are going to use them. The staff of the clinic is going to use them and clean your mouth. And it's one of the first miracles you will experience, because if you've never done scaling and polishing before, the first day you will experience it, you will feel like a newborn baby. Your mouth will feel like a newborn baby. Your mouth will taste like a newborn baby, and you'll be pretty much grateful for that experience. Okay, now after the scaling and polishing, now in most hospitals they have specialists for each type of dental treatment. Okay, we have different type of dental treatments. We have tooth filling. Tooth filling is when there is a hole or a cavity. In dentistry we call it caries, when you have caries that has eaten up some part of your teeth and it is to be filled, right? So we have tooth filling, we have tooth extraction. Tooth extraction is when they are to take out any of your teeth maybe that is damaged beyond repairs. We have tooth whitening. Tooth whitening is when you want to improve the white color or appearance of your teeth. We have the RCT, which stands for root canal treatment. We have fabrication of artificial prostheses. Artificial prostheses, I mean artificial teeth or any replacement of any missing part of the mouth, right? Now, in some hospitals, they have specialists for each of these, so they have to make appointments with the specialists for them to come and attend to you. But then in some clinics, they have somebody there who can virtually do almost all of this. So the dentist now is going to come and based on your own need at that point in time, based on what you discuss from the consulting room. Okay, so they are now, after the scaling and polishing is done, they will now come and carry out what should be carried out. Now, do not panic, do not be afraid. Some dental treatments are actually painful, yes, because in fact, if you've ever experienced toothache before, you know that dental illnesses are not desirable at all. But then any dental procedure that is going to be painful is going to be done under anesthesia, right? You are going to be injected what we call lidocaine adrenaline. Lidocaine adrenaline is an injection that will numb the area of your mouth that is to be worked on, right? It's going to numb, it's going to make the place insensitive, so you are not going to feel any pain at all. Whether the tooth filling, whether extraction, whether whitening, whether root canal treatment, whatever treatment that is going to be done to you, you will not feel the pain at all, right? After the local anesthesia is administered. So do not panic and do not stop being afraid of the pain you are going to pass through. There's no pain at all. After the treatments are done, now in some hospitals they may actually reappoint you for another day and they may tell you to go and come back on a particular date before you meet the specialist that will attend to you. While in some hospitals they will attend to you that very day. Whatever may be the case, just follow the instructions and do what they told you to do. All right. Now, if you are in the dental clinic for a replacement of missing part of the mouth, maybe missing teeth or so, okay, now because of the fabrication, we have to make the teeth that will fit each patient, and then it's actually going to take a lot of time. So in most cases, dentures or replacements of natural teeth is actually not a one-time appointment. You will have to go and come back. Okay, now if it is a replacement that is going to be done on that first day after your scaling and polishing, they are going to do what we call impression taking, right? Impression taking is taking the negative replica of the patient's mouth, like the negative is just like literally, let me say, taking picture of the mouth or so. But then we are going to use something like a gel, and then you put it in your mouth, and it's going to give us a negative replica in which we will cast and get the positive replica that we will use for the fabrication of the artificial teeth or the denture or the prosthesis, as the case may be. Right now, when all of this is done, one of the last thing that you will experience, the last part of your sojourn in the dental clinic is what we call the OHI session. OHI stands for oral health information. Now, in that session, you are going to meet another dentist. Now, in some clinics, they will have, each of these steps will have a different person attend to you, while in some you have some people performing one or two functions. Okay, so now in this oral health information session, they are going to tell you how to brush your mouth correctly, how to care for your mouth, how to avoid oral illnesses, and when to come back for your next appointment. It is very interesting because you will have to ask a lot of questions, and you get answers to all the questions you ask. Okay, so now after this OHI session, you are good to go. And then if they've attended to you, good. If they've not attended to you, you have to come back on your next appointment. But basically, these are the things that will happen on your first visit to a dental clinic. So let me know in the comment section, what was your experience the first time you visited a dental clinic? Let me know in your experience whether or not you visited in the first place. Let me know in your experience what are your recommendations, whether you liked the service or you did not like the service. Okay, so let me know in the comment section what you feel about it. I think we've come to the end of this video. If you are new to our channel, please don't forget to like, share, subscribe, comment, and turn on the notification button. And then if you are a returning viewer, I'm very grateful and I appreciate you for watching this video and staying with me to the end. Thank you, and do have a nice day. Bye.